I am Brian Mears, founder and CEO of Alleviant Integrated Mental Health. You see, I care passionately about how our brain works. And so it's my lifelong goal to bring objectivity to the profession of mental health. Far too long has psychiatry been involved around subjective information gathering. And while that's important, we now have the tools to look at the brain's activities, pair that up with your symptoms that you're experiencing, and create an individualized, personalized treatment plan that can optimize your brain function. You see, in our clinic, we now do electroencephalograms. Now, EEGs are not a new thing, but it is new to be able to do them on outpatient side in a 4-minute fashion that's accessible to everybody. You see, you don't have to have a diagnosis, but if you do, we can treat it. If you don't, but you feel like there's something not right, well, let us look at your brain's activity and see if we can help out with that. In EEG, in our clinic, this is what it would look like. It's 19 leads, and each of the 19 leads, well, they tell us what's going on in each of the 19 regions of your brain. It tells us, in essence, about how many neurons are firing. How well are the neurons communicating together? And are they communicating from region to region effectively? And you see, if all regions are communicating effectively and sharp, it's going to be like a master orchestra. An orchestra that plays in perfect tune, to a perfect beat, a perfect cadence. So I would ask you, just reach out to us. Come in and have an EEG. Maybe you have nothing going on right now, but you want a baseline to see where are you today in the event that you start having symptoms tomorrow. And then we have a baseline to start with. Then we know how to treat your tomorrow's symptoms. Maybe you're somebody that just wants to be a peak performer and you don't necessarily have symptoms that you've ever disclosed to anybody before. But undercurrents of anxiety and stress exist. You just haven't really shared that with anybody. This is for you. We can help with that. Optimize your anatomical brain structure and allow the mind then to be sharper and clearer and more focused. You can process the stress of life in a more efficient way. Now, my friends, I would ask you, why would you not want to have this? Over time, though, many of our brains, they just slow down. Or sometimes we experience damage to one region and not another, and then they march out of tune. When that happens, we experience symptoms. The symptoms can be a variety of things, from mood disorders like depression and anxiety, sleep disorders, PTSD, OCD, behavioral problems, ADHD, autism, addiction disorders, and the list just keeps going on and on. Even things like tinnitus and visual problems. Why? We can see that on your EEG. So now, if you look at this waveform up here, you see an idealized waveform. Now, this would be for a peak performer. Now, you don't have to know how to read EEGs, but I want to take something complex and make it, well, simple. And what you're seeing here, you're seeing a graph that has linear. You could draw a line straight down the center of all waveforms in 19 locations. That means the brain is synchronized perfectly. It's harmonious. It is communicating effectively. This brain will have virtually no behavioral health symptoms, no cognitive impairment, brain fog, sleep disorders, ringing in the ears, nothing. All right? Now that's what we strive for. But most people don't achieve that on their own. Most people achieve something like this. You see, this waveform over here, we see a lot of disruption. We see on the left side delays. We see anxieties. We see concussion. We see flattened waveforms, well, where we should have a waveform that's pronounced. But unfortunately, their anatomy is now skewed. Their anatomy has changed from optimal or ideal to something otherwise. So what do we do at Alleviant? We're able to take this waveform that is, quite frankly, not ideal and help march it back to a pattern of ideal. Now you see, everybody's ideal waveform is different. That's the beauty of what we do. We can create a personalized brain health plan specifically for you and your electrical activity. It is amazing technology. It's called personalized repetitive transcranial magnetic stimulation, or PRTMS. You see, this is a technology that doesn't hurt. It doesn't have any side effects. It does require a daily workout. Well, the same as if you want to be a bodybuilder. You see, if you want to be a bodybuilder or a professional athlete, you're going to work out every day. But we don't exercise our brains every day to create peak performance. Rather, we allow the stressors of the world to impact us to a point that not only does it alter us perceptually, where we view things different than we once did, but it changes our physical structure, our anatomy as well. Now, when we're looking at these EEGs, we're actually looking at anatomy and at electrophysiology. And our job at Alleviant, through this PRTMS system and objective readings of EEGs, it is to resynchronize your brain for you based upon your own readings. Now, this is a change in psychiatry. You see, psychiatry, we have been a profession that's been based really upon how you feel, how you present your feelings, how you perceive the world. And so it's really subjective. We don't really look inside your brain and measure electrical activity or chemical activity. We just listen to what you have to tell us and make decisions that are diagnostic in nature based upon what you say and how you answer questions. But now we can look at your physical brain structure with you. You see, we don't do this alone. We show you the pictures. We help you understand your physical brain. And then we help march your brain back to a pattern of wellness. It's an undeniable certainty that as we change your brain patterns to wellness, well, you do feel better. Does it apply to everybody? Well, no. Not everybody in the world will do well at everything, but it applies to the vast majority of people. And I mean vast majority. There's a couple things that it doesn't work well for. One of those is personality disorders. And the reason it doesn't work well for personality disorders is this is not fixing your mind. This is working on the anatomy. Now, the second thing that it doesn't really help great with are psychotic disorders. Why? Again, psychotic disorders, like personality disorders, they can be a malfunction in the software package or the mind, but not the hardware. So we're dealing with the hardware here. Therefore, it works for virtually everyone to help improve your brain's activities. Who doesn't want to have a brain that is peak optimized? Well, I do. That's why I'm in this profession. I want my family to have that peak optimized brain. I want my friends to have a peak optimized brain, but I want you to have a peak optimized brain as well. If you're somebody that's suffering from symptoms of mental health issues, well, you need to come see us and let us do something that nobody else has ever done in your life. If you're somebody that, well, has never been to a behavioral health clinic, but you're having symptoms of brain fog, you're just not clear and sharp anymore. You feel like your cognition has slowed. You just feel like you're not that same individual that you want to be. Well, let us do an EEG on you. Let's look at your brain waves together and see if there is a treatment plan. We don't have to diagnose you any longer. We don't have to label you and give you a list of medications that, well, you have to fail before you can have a treatment like this. No, my friends, we can do this to keep you optimized now. So whether you're somebody that's been dealing with mental health issues for many years, or somebody that just wants to keep your brain optimized, you see, this treatment is for everybody that has a brain. And it's for everybody 3 years old and above. Yes, you heard me right. We're even treating 3-year-olds with this technology, and it works. My friends, this is a change in psychiatry, an objective measure. In my background, I did anesthesiology before psychiatry. And in anesthesia, we would never put you to sleep without measuring your vital signs and continuously measuring vital signs throughout a procedure. We were always looking at your heart to see if you have any sort of heart arrhythmia. Well, now we can look at your brain to see if you have a brain arrhythmia. This is important. We can look at your brain and see if a brain arrhythmia can be taken back into perfect health, perfect synchrony, to an idealized waveform just for you. And then you'll get peak enhancement of all mental faculties. That's our goal. This doesn't hurt. It works better than anything we could offer, and it is an objective tool. So what does this process look like? Well, you need to reach out to us to schedule your EEG consult. Now you'll come in for an hour-long appointment in which you'll see one of our providers, get some very basic information, perform your EEG. That does not hurt. It's 4 minutes long, but then we have to read it. We will go through your EEG with you at that point and discuss what we see. And then the goal is to outline a treatment plan, if there is one, that's personalized just for you. If PRTMS is in your future, then you would come back in for daily treatments. Now, why daily? Well, use your brain daily. If you want to be in peak physical performance, you would go to the gym daily. We need to exercise your brain daily. It's like physical therapy for your brain. The more that we can exercise your brain with our personalized RTMS plan, the more optimized your brain will be faster. The first week will be about 40 minutes. Now that may seem like a commitment, but my friends, you're no different than the other people that we've treated. We've treated judges, physicians, lawyers, people that work in factories. We treat school-age children daily. People manage. You know why? Because you've been struggling for too long. And you figure out, how am I going to manage this for now? But you will figure it out. Why? Because you need it. So you come in daily. The first week will be about 40 minutes a day. The second week and on is about 30 minutes a day. Every single week, we're going to do a new EEG on you. And you're going to see side-by-side comparisons of your EEG. You see, it's all about you and how you feel. So, as you answer our questionnaires and you tell us, I'm sleeping better, I have less anxiety, my relationships are better, I'm clearer, I'm less depressed, whatever your symptoms are, and then we match that up with your weekly EEGs, only then do we know how long the duration of these treatments are. But what we frequently see is, for most people, it will be between 3 weeks up to about 3 months for the most severe diagnosis. Some of the severe diagnosis may be something like a traumatic brain injury. Maybe you've had a brain tumor and had surgery, and now you're just not the same as you once was. That may be longer treatment than if, well, you just have some slowed cognition and you don't know why. Maybe you've been in a car accident, or maybe you're a high school or junior high football player and you've been smacked in the head too many times. Well, you see, those concussions result in physical damage. Until we monitor your EEG weekly, we won't know how well you're performing, how well that anatomy's turning back on, how well your brain is communicating well together again. But every week we do this. So the average person, again, it's going to be around 30 total treatments, which is around 6 weeks of treatment. It's in a spa-like environment. You're going to sit back in a very relaxing chair, and I promise, everybody really enjoys it, including our little children that have autism. They enjoy it. Now, I frequently am asked, how long will this last? Well, I have to ask you a question. If you've been on medicines, how long does your medicine last? Doesn't last very long, does it? You have to take it daily just to try to feel somewhat normal. This, however, is not a medicine. When we exercise your brain, we re-engage the anatomy and physiology. It starts firing correctly, working together like that marching band. And it's synchronized and harmonious. Well, if you're not experiencing the same reasons that led you here, the same reasons that your brain became disordered in the first place, it should last from now on. But if you still are experiencing the stressors of the world, maybe that's a tough relationship, financial difficulties, major life stressors, that's understandable. All we can do is work on the anatomy, and we can help with that. Your lifestyle is something else that we have to help with. So once your brain is working more efficiently, well, you may process stress better, but it doesn't mean it's going to eliminate the stressors in your life. So let me give you one other example. If you were a professional fighter and you came in and had PRTMS, and we optimize your brainwaves, and then a month later, you go to the ring and you get knocked out. Well, my friends, that may mean you need to have PRTMS again. because you just went and had a major stressful event leading to a mild traumatic brain injury, a concussion that harmed your physical brain again. And if that happens, you need to come back and see us so we can help optimize that again. Outside of that, the duration, it's lasting as long as your lifestyle allows the duration to be lasting. And if your lifestyle doesn't, that's okay. Let us help you work towards that. But that's more on the mind side. That's why we have a comprehensive model of therapy and psychiatry providers that are all trained in this as well, where we can help you troubleshoot your life, problem solve your life, to allow your brain to continue working optimally. So it's all about how are you problem solving your life now, once your anatomy is working effectively. Now, this technology is new to your community, but it's not a new technology. You see, the Department of Defense has been using this technology for many years. Special Forces uses this technology. You know, even the Notre Dame football team has been using this for many years. Now Stanford, Mass General Hospital, Johns Hopkins, Walter Reed, many large facilities around the country use this technology, but we wanted to bring it to you. We wanted to bring it here to our local communities so we can use it ourselves. Our friends and family can use it. So we have it accessible right here, right now for you. Now I know some people have very sensitive jobs in which you're super concerned about coming to see somebody in mental health. You don't want to be labeled as a mental health patient. You don't want to have a diagnosis. You don't want the medications and the side effects associated with those, but you're struggling. So many people around us have experienced traumas, whether it's military, whether it's first responders, whether it's our judges and lawyers, our police officers, our firefighters, paramedics, airline pilots. There's so many different jobs that are very stressful, but you don't want that label. I understand. And I'd like to offer you this solution, a PRTMS. Come and have an EEG. Now that consult, we can do that on a cash-based system. So it never even has to go through your insurance. All we're doing is we're looking at your brain waves, seeing where you're struggling, and then we're working with you to optimize that. That's it. Now I know this is very appealing to first responders. It's appealing to our military. That's why Department of Defense does this. I know it's appealing to you as well. But for those of you that are experiencing significant symptoms right now, don't put it off any longer. This treatment is the treatment you've been waiting for, the treatment you've been hoping for, an objective treatment that does not have side effects to it, an objective treatment that doesn't have to go through insurance and label you, an objective treatment that, quite frankly, other people don't even have to know about, an objective treatment that optimizes your anatomy. It's here for you right now. I invite you to reach out to us and let us help you on your path to wellness. I would like for you to follow this video series because we will have many modules that are coming out very soon to keep you educated on what PRTMS is, how it's working for our patients. You'll get to meet patients and their testimonies. You'll see how their lives have changed. We'll even show you the EEGs before they started and weekly after they started until they received full remission of symptoms, until their brains were peak optimized. So here at Alleviant, we are here to help you. All you have to do is reach out at 866-951-4325 or go to alleviant.com. Go to the right-hand corner that says Schedule Now. Click the button, fill out your information, and come and see us. And start your journey to a peak performance brain.